Paul Barabani, a retired colonel from the Massachusetts Army National Guard, was superintendent of the Holyoke Soldiers Home from 2011 to January 2016. While there, he said his calls for additional staff and facility upgrades went largely unfulfilled. Now, in the wake of a COVID-19 outbreak that killed at least 76 veterans and infected other residents and staff, he and other members of the Holyoke Soldiers Home Coalition are advocating for some of those same changes.
I intentionally did not make any statements during the investigation. I did speak to each of the investigation teams, but I didn't want to wade into those waters. I had no firsthand knowledge of what went on. Certainly I can provide background on how we got to where we were. And the motivating factor was my listening into the Board of Trustees meeting on the 9th of June, where on the agenda was an item for the new Soldiers Home in Holyoke. Well, that certainly perked my interest. And when I listened to the chairman of the Board of Trustees make statements suggesting that the home had outlived its usefulness, and that their source of information about a construction project was actually a television report on Channel 5 in Boston, I was flabbergasted that this project, which has been on the books since 2013, approved by the VA, that nobody in state government, that DVS or DCAM, HHS would have made the trustees aware of a potential solution. And so at that point, I did release a statement and became involved, and here we are today.
And there are a number of things, including looking at renovating the home that you and members of the coalition are advocating for. But I want to ask about the question that you sort of touched on there, and it's the way administrative oversight of the home works. Your former superintendent, you just talked about how the trustees may or may not have been in discussions with several state agencies that have a hand in the administration of the home. And then, let's add another layer, the federal government gets involved once a year and does an inspection of the Soldiers Home. In your experience, you were superintendent there from 2011 till January 2016 when you decided to resign. Are there too many hands involved in the oversight of these homes?
That's one way to put it. I think that when I was hired, let me take it back even further. Let's go back to 1952 when the home was opened. And it was opened as an independent agency with a board of trustees. And yes, the board is appointed by the governor with 7 members of the board, but each one in a rotating tour of 7 years, so that there's always turnover within the board. So it would avoid one point of view, and that the members would basically act independently, and it gave them the power to hire the superintendent and also to fire the superintendent, which is very important. When I was hired, I answered to the assistant superintendent at EOHHS. I would attend monthly meetings in Boston at the Executive Office of Health and Human Services and be able to provide direct input as to what my needs were, what issues I had to, or challenges we had. When it was restructured and put the soldiers' homes under the organizational structure of the Department of Veterans Services, I lost that direct contact. I lost that voice, and all of my actions had to go through DVS. And I was never certain which of the issues that I had raised had ever gotten directly to DVS, to EOHHS. So there was another link or obstacle in my mind that I had to overcome to really bring my issues forward. And those issues addressed, I think, serious contributing factors to what occurred, that being the physical structure needing renovation. And that's why we initiated the request in 2012 for the construction project at the home, which was later approved. And also continually raising the issue of insufficient staffing. I feel that those are the 2 major contributors to the rapid spread of the infection at the home. 2 items which, again, I had advocated for years, nearly 10 years, from the occurrence here. So that change in the organizational structure, putting us under DVS, I think had a significant was a significant factor. And that's why one of our recommendations of the coalition is to actually put the soldiers' homes under the supervision of the Department of Public Health under their special hospitals program, and Western Mass Hospital is an example of that. And so that we have a robust source of information that people could respond directly to any challenges that we faced. When I was there, we had a scabies outbreak, and I was immediately on the phone with specialists at the Department of Public Health to address and recommend how we move forward. This convoluted chain without any true expertise costs critical time, and time is so valuable when you're into a crisis. So I truly believe that putting them under the Department of Public Health would be a much better organizational structure.
But in terms of the coalition's request to have the trustees have more oversight in this process, trustees aren't paid, if I'm correct. They're volunteer positions. So would that be putting on too much work into the hands of volunteers?
I don't think so. I think that we could find truly dedicated people who have their heart and soul in what's good for veterans. And that's why one of our recommendations is, rather than have all of the trustees appointed by the governor, let the veteran service organizations, the American Legion, VFW, DAV, Vietnam veterans, let them have a representative seat on that board, because we know where their heart is. And they're not going to go and just go along because they got appointed and they feel a sense of obligation to the appointing authority. They're going to go and they're going to truly state what is good for veterans. And I agree with having people with some medical training and awareness on the board. But again, who it is that appoints those individuals becomes a key question. I think that the veteran organizations need a voice. They will certainly support their veterans.
Something else you touched on when we were just speaking, you mentioned the superintendent's position being overseen by the trustees and that they had hiring, firing authority. So do you think that the governor and Health and Human Services and VA made a misstep by firing Bennett Walsh? He's certainly challenging that now.
Well, I'm not certain. Oh, you're talking a legal misstep. Yeah, that's a pretty complex subject. But what is interesting is that when I was hired, the Mass General Law clearly stated that the trustees were the hiring authority and also had the authority to fire, but it had to be for just cause or inefficiency. So there was a set of criteria for that. And then the appeal of that would be to the court system. That provision of the law was strucken out during the Baker administration. I see it as purely an attempt, for the governor to be able to control who sits in that job. And to say that the Secretary of Health and Human Services, one of his appointees, would be the person that appoints the superintendent, continues to have that chain of loyalty to the administration in power at the time. I think that would lead to turnover of the superintendent with each new administration, and thus disrupt the continuity. And again, the people in 1952, when the home was open, whoever put the provisions into the general law knew what they were doing. They wanted to protect the home. They wanted an independent voice for the veterans, i.e. the trustees. They wanted those trustees to be able to decide what was right and to have a separate funding source, because again, it is a separate agency. It is not funded through DVS. It is a separate agency for funding. So all those things that were designed in 1952 have been diluted. And that dilution of their authority, in my mind, is a serious contributing factor to where we are.
So what do you think it's going to take to get that back on track? And as you point out, or as you see it, gives some more teeth to the trustees and the mechanism that the founders in the 50s wanted to see this home have.
That's one of our positions of the coalition, that we want a voice. And the community wants a voice, and the veterans organizations, all of which are part of the coalition, want to have that voice. And we could bring that perspective to the table and let people consider them. I think that the Baker administration's proposals, including having filed legislation, is premature.
But have you heard back from the governor at all on that request for this coalition to have a voice, to be heard in this process?
Not at all. Not at all. No, I haven't. When I was superintendent, hired by the Board of Trustees, advocating for what they set as priorities, But then my annual performance review was being done by the Secretary of Veteran Affairs. It made no sense. In fact, I'm certain that my persistence in pursuing additional staffing and trying to correct the problems at the home became an irritant, to DVS and EOHHS and probably up to the governor's office as well, because we pointed out what was wrong. We appealed for what was necessary to remedy the problems, and our whole situation was just brushed under the carpet. They really didn't want to hear it. I think it was very clear at the time of my retirement that those facts were brought out, where I publicly stated that their failure to act is putting veterans at risk. And the Secretary of Health and Human Services stood before that audience, and I know at least 3 occasions where he misrepresented the truth. I called it deceit at the time. Other people may have other words for it, but he was not telling the truth about the impact of the early retirement program or about the amount of money that we received in the budget. And talking about budget, I've done analysis that demonstrate that the Soldiers Home in Chelsea, which has approximately 100 fewer long-term beds than Holyoke, but yet their budget is over $6 million greater than the Soldiers Home in Holyoke. And a preponderance of the money is on long-term care. They obscured that fact by saying, well, Chelsea has more beds than we do, but most of those are independent living in the domiciliary program. So I now went down to looking at specifically nursing salary to see how much they're spending on nurses at Chelsea as opposed to Holyoke, and it was nearly even, within 1% of each other. When I took the nursing salary and divided it by the number of long-term care beds at each facility, my conclusion was that Chelsea was receiving over $25,000 per resident bed more than Holyoke. And that has gone on historically. And so when you look at the Pearlstein report, which starts with the crisis of March of this year, they failed to look at what led up to that crisis and what created it. And understaffing was, again, a serious contributing factor.
And that's something that you and members of the boards of trustees who have moved on, who former members of the boards, have been, or an issue you've been raising for quite some time.
Yeah, well, the story goes that in 2014 that I raised that to our annual legislative breakfast, having the legislators throughout Western Mass and Central Mass as well that would attend, and put it out there and showed our lack of specifically nursing hours in overall hours. And each year, the governor would prepare the governor's budget, but we would go and through our legislators, look to increase that to get sufficient funds to actually continue to do our operation without degrading care. And that would be probably a 3 to 4% increase each year. I read trustees' meetings from this past year that the Soldiers Home was told that they would put in for a 1% increase. Well, 1% increase is actually a decrease. And when you decrease the budget, you cut corners and you compromise care. And I've got some specific examples, but not to get into at this time, but where care was compromised because of a lack of a budget.
Do you think that if your warnings had been heeded, you had been listened to about the concerns that you had, that these deaths of these veterans could have been avoided?
I certainly believe that the physical structure, the room size, as well as the lack of staff were serious contributing factors. And had those 2 items been mitigated and corrected, I think that the spread would have been much, much slower, and thus the number of deaths would have been significantly reduced. Absolutely.